Hello, and welcome back to the next episode of this Healthy Life podcast. I'm very excited for my guest today. I have Tsan, who's a certified lymphedema wound therapist and California board certified licensed acupuncturist. She specializes in surgical recovery and a holistic pain management plan. She has expertise in manual lymphatic drainage, medical compression fitting, and acupuncture, and she helps her patients with post-surgical anxiety, releasing emotional trauma, and promoting overall healing. She also happens to be my manual lymphatic therapist, who's been helping me with my recovery from my latest diagnosis of lipedema, and it's been quite the journey, but having her by my side has been so helpful. She's so knowledgeable and so helpful in the healing process. So very excited for her to be here today, sharing some of my journey and also some of her expertise and how she's been helping other patients. So welcome, Tina.
Hi, Erica. Thank you for having me.
Yeah, thanks for being here. So I'd love for you to start with an introduction. I introduced you a little bit, but I'd love for you to share a little bit about yourself and some of your experience and how you got into working with lipedema patients and doing this sort of work.
Yeah, absolutely. I am a doctorate of acupuncture and Chinese medicine. When I was getting my doctorate degree, I had to write a capstone research paper, and I was struggling with the topic. And at the time, one of my friends sent me a link, a YouTube link of a clip. It was like a 5-minute clip of this medical doctor giving a lecture at the Harvard Medical Lymphedema Symposium. And she was talking about the usage of acupuncture for the treatment of lymphatic diseases. And that really piqued my interest, because throughout my whole education in acupuncture, from my master's degree to my doctorate degree, not once did the word lymphatic diseases or lymphedema or lipedema came up. So that really piqued my interest. And then I was like, okay, I think this would be enough material for a capstone research topic. So that started me to go down on this year-long journey of doing research into what is the lymphatic system, what happens when it is diseased, and what's the disease process involved with the system. And then I learned that a certified lymphedema therapist is the healthcare professional that treats lymphatic diseases. So naturally, I went and got certified. And throughout my education and training as a lymphedema therapist, I learned about lipedema, which also fits in the category of lymphatic diseases. I also learned about wound care. And once that became my specialty, I just naturally got contacted by surgeons in Los Angeles to ask if they can refer me patients. You know, I learned that this is a very specialized niche and there's not too many of us in this profession. And because I'm one of the few in LA that specializes in lipedema recovery and lymphatic and lymphedema management, I just showed up on the Google search results when these surgeons are looking for someone to refer their patients to for recovery. So I'm really thankful to be on the map and to be referred patients throughout LA by plastic surgeons.
It's amazing. And it's so helpful to have a resource like you helping people because, you know, with a lot of these conditions, like you go to your doctor or you have these surgeries and then they might do a check-in with you like once 2 weeks and maybe 30 days. And after that, like 3 months, but you don't really have support and you need so much support when you're recovering from these conditions. And so having someone like you that understands kind of the aftercare and healing the lymphatics is so important. So
yeah, absolutely. You know, after surgery, it's quite a recovery process for lipedema. It's not a 1-week process or a 2-week process. It can be quite lengthy, at least 3 months, sometimes up to a year. And usually it's not always just one surgery. Almost all my lipedema patients have at least 2 surgeries, 2 or 3. So you're looking at about a year of recovery. And I find it is really helpful and necessary to have a licensed healthcare professional that these patients can refer to on a regular basis to check in with them and let them know if things are going well and guide them along the healing process.
Absolutely. So let's start with a little background because I haven't shared a lot about my own personal journey. I was diagnosed with lipedema in February this year after about 8 years of struggling with different swelling, lymphatic disorders, weight gain, mostly triggered after I got my stem cell therapy for Lyme disease. And so I'd love for you to kind of break down a little bit about what lipedema is. It's often confused with lymphedema, which is a different condition, but they can also coexist. So I'd love for you to break it down and share what each condition is and what some of the symptoms are.
Yeah, absolutely. So in technical terms, the difference is dynamic insufficiency of the lymphatic system versus mechanical insufficiency of the lymphatic system. The lymphatic system responsibility is to remove protein-rich fluid from your connective tissue, from your interstitial tissue space, and is a part of your immune system to flush out cellular debris. And when the system is impaired, you get swelling, you get fibrosis, you get skin changes. Now, when the system has broken down and there's a mechanical deficiency of the lymphatic system, such as missing anatomy, such as missing lymph nodes, or maybe radiation have impaired lymph vessels. So when the system itself has mechanically shut down and there's missing anatomy, you have lymphedema. You have a system that is no longer functioning, like very much like a car's engine has broken down. But when you have a system that is intact, the anatomy is intact, lymph nodes are intact, lymph vessels are intact, but its function is being impeded, that is lipedema. So lipedema is when you have this fibrotic fat, this abnormal fibrotic fat that grows and it's deposited into your connective tissue and surrounding extracellular in the tissue, and this fibrotic fat impedes on lymphatic function. And then the lymph system can't flow and drain as properly, so then you get backed up swelling. So that's the main difference between lipedema and lymphedema, where the system is either being impaired upon or the system is not intact.
Gotcha. And correct me if I'm wrong, but lymphedema also can sometimes only affect one side of the body, whereas lipedema is both sides. Is that correct? That's another way that you can kind of notice a difference.
Yeah, absolutely. It's understood that lipedema is affected bilaterally, both sides of the body. So you'll see symmetrical swelling, symmetrical distribution of abnormal fat. Versus lymphedema, lymphedema can happen bilaterally. Lymphedema is where the anatomy is impaired. So if the anatomy is impaired on one side, then you'll have swelling on one side. But if you have, let's say, radiation done on the abdomen and the lymph flow of bilateral extremities is impaired towards the abdomen, then you have swelling on both sides. So instead of thinking of which extremity is involved with the diseases, rather think about where is the anatomy impaired.
Yeah, that makes sense. And so it can also occur that you have both, right? There's in certain stages of lipedema, if you get to a farther along state, you can start to develop lymphedema as well. So how does that develop when you say you don't have radiation or you don't have lymph nodes removed? How does lipedema cause lymphedema?
That's a very good question. So back to dynamic insufficiency and mechanical insufficiency. When you have a system that is intact, like in lipedema, but you have this fibrotic fat that is impeding on lymphatic function and pressing on lymph vessels and preventing it from draining properly, over time, that excessive accumulation of fibrotic fat in your advanced stages of lipedema causes such a strain on the system and such a backup to the system. Now the system is starting to fail. Now this dynamic insufficiency is causing a mechanical insufficiency. Gotcha. So that's how you end up having both lipedema and lymphedema. This is seen in late stage lipedema, stage 4 or beyond, where the fibrotic fat has grown out of control, way out of control, and it has now broken down the system, and the system is no longer functioning.
And that's a great point. Let's talk about the stages of lipedema, because there's technically 4 stages, and I think there's 4 or 5 types depending on what part of your body is affected. Yeah. Can you share a little bit about what kind of each stage is, how to tell maybe what stage you're at, and what the different types of lipedema are?
Yeah. There's a great visual that you can Google and look up. If you Google lipedema online, you'll see an image that will illustrate stage 1 to 4. It's really important to know that skinny people can have lipedema. It's often misunderstood that only larger women have lipedema. So in your stage 0, stage 1, it will be subtle signs of lipedema, and the female might look normal. You might think like, hey, you're pretty slim. There's nothing wrong with you. It's just in your head. But at stage 0 and 1, you'll see some subtle signs of swelling that is unexplained. The most common feedback, most common narrative I get from patients is, but I'm so athletic. I work out all the time. I work out every day. I'm at the gym. I eat healthy, but I just can't get this fat off.
Yep.
I'm not losing weight. So with lipedema, it's a abnormal development of fibrotic fat that gets deposited in the body that is resistant towards dieting and exercise. So stage 0, stage 1, you will experience some subtle signs of maybe swelling and just frustration that no matter amount of exercise or healthy eating that you do, this fat just won't go away. Yeah. And at stage 2, you will notice more deposited fats. You might see what they called grain-like, bead-like texture underneath the skin. You might feel some little round balls of fibrotic fat throughout your skin. You'll notice that it's a little graining. And this fibrotic fat can, when you touch the body, it might feel sensitive, you might bruise easily. But at stage 2 and 3, you will see more visible deposits of fat. And it's usually on the hips, the legs, and then at stage 4, it progresses to a very advanced stage where it's very noticeable, and you might see some ankle cuffing as well.
Yeah, I want to talk about that a little bit. So some of the telltale signs that I find too is like the cuffing. So I even have some of that in my forearms a little bit. So it doesn't affect your feet and hands, but it stays in your limbs. And so it's interesting because it can affect your arms, it can affect your legs, like you said. And, it can start very mild, but it definitely gets triggered by different hormonal events as well. So a lot of times it is a genetic condition. So if you are going to start developing it, you start seeing it in puberty and then through different stages through hormonal changes. And it mostly affects women, lucky us.
Yeah, right? We're so lucky.
The men barely get affected by this. Although there have been some cases in men, but very rare.
Very rare.
But it's more tied to hormones and genetics and lymphatics. So
yeah, it almost exclusively affects women, maybe 1 in a million men. I'm not quite firm on that statistic, but very, very rarely in men. So almost exclusively affects women, and it's hormonally related. And you will see moments of exacerbation during hormonal times in a woman's development, most notably during puberty, pregnancy, and menopause. So those are the 3 major hormonal events during a woman's development that there's big hormonal shifts during that development phase, and it can trigger this abnormal development of lipedema fat.
Yeah. And once it turns on, there's not really much you can do to stop it or get rid of it other than surgery is kind of the gold standard for kind of putting it to rest. So
and that's the maddening thing about lipedema. I've worked with thousands of lipedema patients by now, and my heart really goes out to them because you have a whole patient population of women who are healthy individuals who try so hard to live a healthy lifestyle. They eat healthy, they eat clean, they exercise, but yet they can't get this fat off, and they don't know that it's just because they have a disease. They have an abnormal growth of fibrotic fat that is disease material. And sometimes they go to the doctor and they're seeking help. And because lipedema is still not a well-known disease, they might get shame. They might get fat shame and go, are you sure you're not slipping in that cookie or that cheesecake and not telling us? And that's why I appreciate you inviting me on here to this podcast, that yes, lipedema almost exclusively affect women, and it is a disease, fibrotic fat that grows. It's resistant towards dieting and exercise. And I think those who do seek surgical intervention will find that it's a very helpful way to help minimize this disease progression, because there's really no amount of healthy eating and dieting will help starve it away.
Yeah. And even, I feel like a lot of women with lipedema develop borderline eating disorders. And, I even feel like I've done like some very unhealthy things for myself, just being like, I keep gaining weight. Like no matter what I do, I go to the gym every day. I eat so clean. I'm barely eating. Like what's going on with me? And, you develop these bad habits of like doing fasts and starving days. And it doesn't really make a difference. It might set you back a pound for a day to give you some mental relief. But in the end, it's not stopping the disease, and it's not your fault. It's something that's beyond your control. It's something that's gone haywire in your body that has developed this condition. So
yeah, absolutely. And so the treatment for it, I know there's still a lot of shame and guilt around getting liposuction. up until I think still recently. I mean, I'm in the industry, so it's a little bit more normalized, but outside the industry, when I talk to friends and family, it's still considered this hush-hush topic around getting plastic surgery. So I think we should normalize it more. I'm in LA, it's pretty common. Yeah. And plus with lipedema, it's a fibrotic fat. And if you have a medical treatment available to help you, why not go for it? If it's within your budget, if you can afford it, why not go for it? And let's remove the shame around it. This is a fibrotic fat that is out of your control. It's really a terrible disease in that you feel helpless in a lot of ways because no amount of healthy eating will starve it out. So if there's a medical treatment available, such as liposuction, why not go for it?
I agree. Yeah. I mean, it's hard. I think in LA, it's definitely a lot more normalized because people are just so kind of, there's plastic surgery in your face everywhere here, right? And it's like a little bit more normalized. But in other places, I think that, like you mentioned, there is a lot of shame that people somehow carry for it. And, you have a medical condition that can be helped for this, and there shouldn't be any shame in seeking that medical condition. If you had cancer and you got a double mastectomy and then got, breast reconstruction, you're not shamed for that. And you had a medical condition and that's still plastic surgery, right? So why for a condition like this do people feel so much shame around it? And I think part of it has to do with like our medical system letting women down so much. Like you said, people will be like fat shamed by their doctors, and doctors don't have an understanding of this condition. And me, myself, I went to doctors for 8 years, desperate to try to figure out what was wrong with me. And, people were like, oh, you're just having a Barbie moment. Like someone literally said that to me, and she's just like, you look fine. And like, people are just so dismissive, even though you have this internal battle. And, I did HCG 10 times to try to manage it, which is just awful too. And probably like mess with my hormones as well. So it's like, you go through so much trauma and then you start to just not even tell anyone about it. Like I would just kind of disappear every January and do a round of HCG and kind of reset myself so that I could feel like myself again, even though it would just keep coming back. So it's like, they don't know like the struggle that you go through. And I wish doctors were more educated and not so quick to jump on you and kind of shame you. And then also peers as well, just because you do liposuction, even though that happens to be the treatment for this, like you shouldn't feel bad about doing it. And it's there for a reason, and it's there to help people with these conditions. So
yeah, absolutely. And also, why not look good? If I'm going to spend all this money on surgery, why not have it be both a medical treatment for the disease and also something to help me look better?
I'm so glad you brought that up because I'm in a lot of lipedema Facebook groups, and I kind of use that as a resource to find what surgeon I wanted to go to. And for me personally, aesthetics were important to me because after battling for 8 years, like fighting my body to kind of just look like myself and feel like myself, I was like, there's no reason that I shouldn't want to look good and feel good in my body. So, and I find so much in the community that there's like a shame almost imposed by other lipedema patients that are like, oh, you should just be worried about getting the disease out and not what you look like. I'm like, well, why can't you have both? Like, why is wanting to look good and get the disease out not equally important?
And here's the amazing thing. You can have both.
Exactly.
Liposuction is done by board certified plastic surgeons. And when you're performing plastic surgery, you have to pay respect to the aesthetics. If you don't pay respect to the aesthetics, then you risk looking botched. Nobody likes that term. Nobody wants to look uneven or dented. There needs to be a respect to the aesthetics of the medical procedure. We do this with braces. We do this with other procedures. If a child is in their developmental age and they have very crooked teeth, we bring them to a dentist to get braces so that it straightens because it affects their self-esteem. So you have to pay respect to the aesthetics. So if you're going to spend all that money, it's not cheap. It's so expensive.
And insurance is a battle to cover it, even though it is a medical condition and should be covered. It's still a battle, and oftentimes you have to pay out of pocket before you get reimbursed. And it can take up to 9 to 10, 12 months to get reimbursed for your surgeries.
And it's usually not just one. It's always 2 or 3. I'll just make up a number. If I'm going to spend $60,000, $80,000 on the surgical procedure, plus the post-op care and the cost of wearing all these compression garments, I better come out looking pretty decent, pretty good.
Absolutely. And feel good about yourself when you're done too, because I mean, not only is this a physical disease, but it also messes with your mind and your self-esteem. And I've even noticed in myself, like at the gym, I would be working out and I would look in the mirror, like doing my weights and stuff, be like, I'm doing everything right. Like, why do my legs look so big? Like, what's wrong with me? What's wrong with my arms? And now, you know, since I've had the surgery on my legs and part of my arms, I'm in the gym and I'm like, wow, look at my legs. I can see my muscles. I'm like working so hard. So even just the self-talk has shifted for me. And it's like, obviously I'm healing physically. I've stopped the disease progression, but also just the mental health and wellness and benefits that have come from, you know, having a successful surgery.
Yes, absolutely. This surgery is transformational for a patient, not just as a disease treatment to get rid of the fibrotic fat, but also just to help boost self-esteem, morale, and to regain trust in oneself. Can you imagine all those years that a lipedema patient has gone through with this fibrotic fat that grows that's out of their control? And most of these patients have tried everything from eating healthy to exercising all day, all night, hiring trainers, hiring nutritionists, seeking medical counsel. And after all this effort, being told that they're fat and being fat shamed, and then finally realizing, oh, actually, it's not me. I actually have a disease. To go through all of that, the patient by then, when they've discovered their disease, discovered their diagnosis, have gone through so much trauma, emotional, physical trauma, that after the liposuction, what I do in our sessions is also a lot of talk therapy. I let them voice their trials and tribulations with lipedema. There's a lot of venting that happens, and they have to release all of that. So in our session, not only are they getting decongestive therapy to help with the post-op swelling, but also some sort of talk therapy, an safe space for them to just voice out all their frustrations and just let go.
And they have someone that finally gets it and that knows what they've been through and is there to like listen and support them, which is so nice and refreshing after, like you said, like years of going to these doctors that just, you know, kind of brushed you off and said you were fine and that you're just eating sneaking treats in private when most of us aren't eating anything because we're so traumatized. So I want to touch a little bit about the surgery. So we mentioned that obviously liposuction is a treatment for lipedema. And can you talk a little bit about how that's different from, say, someone that's going in just for plastic surgery, just for aesthetically doing liposuction? So the one for lipedema is definitely a little bit more, what they call 360. So it's a little bit more aggressive and the recovery can be a little bit more difficult. So I'd love for you to share the differences between lipedema removal surgery and a traditional liposuction.
Right, very good question. That's why it's important to seek a specialist in lipedema surgery. With cosmetic cases, liposuction is usually done for body contouring. So it's advisable for cosmetic cases that you get down to your ideal gold weight, and the liposuction is done spot treatments to just help do some better contouring that you otherwise wouldn't be able to achieve in the gym. So these are healthy individuals who are beautiful and want to attain a little bit more perfection. No shame in that. And liposuction can achieve amazing body contouring results for cosmetic cases, and it's usually just spot treatments. With liposuction for lipedema, it's more aggressive, it's more involved, and like you mentioned, it's done 360 all around. Now, the only area where the two categories overlap is the abdomen. So 360 all around the abdomen is done in both cosmetic cases and lipedema. But the difference for the legs and the extremities, you will never really have a plastic surgeon who does just purely cosmetics who will do 360 all around the arms or 360 all around the legs. If you want circumferentially liposuction done around your limbs, you would have to seek a lipedema specialist. And this is done strategically. There's two main strategies that I'm aware of. Let's start with the legs. One strategy is to do liposuction 360 just around the upper leg, and the next session, when you come back, they'll do 360 around the lower legs. So the surgeon will break it up that way. Another tactic is to just do full interior of the limb, come back another section and do full posterior. So the main difference between lipedema liposuction, cosmetic liposuction is that circumferential treatment.
And let's talk about why the surgeries need to be broken down into multiple surgeries. Like there's some states have liter limits on how much you can take out per session. And then also just for the health of the person, you don't want to put them through so much shock of removing so much volume at once. But can you talk about kind of like the different volumes that doctors can remove and why it's broken down into multiple surgeries?
Yeah. That's also another really important point. Liposuction for lipedema is, we call it lymph-sparing liposuction. It is a lymphatic disease, and the reason it's a lymphatic disease is because of fibrotic fat impedes on lymph function, right? And when you remove fat from the body, it is an invasive procedure. The surgeon's taking a small cannula, making a little incision in the skin, going in and gliding it back and forth in that fatty layer to suction out the fat. Naturally, you're going to get swelling when that surgery is being performed. With that swelling, it's going to temporarily overwhelm the lymphatic system. Not to mention they also pump you with tumescent fluid, which is a type of anesthetic fluid. So pumping of tumescent fluid and the nature of the surgery itself will produce a lot of fluid that the lymph system needs to remove from the body. And it's a lengthy process. It takes the body about 3 months to a year to remove all that fluid. And that's why it needs to be done in sections. If you do 360 circumferentially liposuction on the limb, on the whole limb, that is too much on the system. It will overwhelm the system to a point where it might risk getting lymphedema. So to be cautious, the surgeon will break it up in parts to help not overwhelm the system.
That makes sense.
Yeah.
And so I want to shift gears and talk about the aftercare because, you know, surgery is one hurdle and, you know, that can be intense on its own, but I don't think people realize how intense the aftercare from this procedure is.
Right.
And, you know, how on top of things you need to be. So let's talk a little bit about aftercare. You know, compression is very important to make sure you're helping with that swelling, helping your body heal, and then also incorporating manual lymphatic drainage to help get that fluid out. But I'd love for you to share kind of a good aftercare protocol and why that's so important.
Yeah. The post-op recovery is, it's very involved with lipedema. Typically, surgeons recommend 2 MLD sessions. MLD stands for manual lymphatic drainage, where a trained therapist does lymphatic massage with their hands, not a machine or a suction cup or devices. It's done manually, strategically, with specialized techniques with their hands, directly hand-to-skin contact, to help the lymph system drain all that fluid. So MLD, manual lymph drainage, is recommended twice a week for the first 6 weeks. And then after 6 weeks, reevaluate to see where the patient is at. And you can continue for once a week up to 3 months post-op. And that's really important because your superficial lymph capillaries are rebuilding during that time frame, and the therapist who does the MLD will support the lymph system in drainage while your superficial lymph capillaries are regenerating. In addition to helping the patient drain lymphatic fluid, you wear compression garments. Compression garment is what is working around the clock all day, 24/7, 23/7, except for when you remove it to do the MLD. It's working around the clock to support your lymph system in absorption of fluid. Those two done together supports your lymphatic as you're healing and decongest the patient. And the reason why it's so important to get rid of all that fluid and support the lymph system in absorption of fluid is that when fluid is being stagnant and accumulating in your soft tissue and is not being absorb as quickly as the body will like it to, then it creates skin changes. It hardens the skin. It makes the skin lumpy and bumpy. The texture changes. It feels like leather. And this really scares the patient.
So that's fluid that's hardening. Is that right?
It's like congealed fluid.
Yeah.
It's hardening. It's sitting around and it ignites an inflammatory process where the body creates scar tissue. So the lymph drainage, the MLD, and the compression is to decongest the body, but also prevent scar tissue formation.
And then, so if people don't have access to MLD, does compression on its own offer enough to prevent some of the scar tissue and congealment from happening? Or is it really important to make sure that you're finding someone that can help you with lymphatic drainage support as well?
Man, that's such a tricky question. I think if you are fitted in the proper dosage, because each patient responds differently to the dosage of the compression garment. Some patients need a higher dosage, some are okay with a lighter dosage. I think if you have the proper dosage for what your body needs, you might or might not need the MLD, but how many patients were able to figure out their proper dosage, right? That's like leaving the patient to just figure it out for themselves. And if they can't figure it out and don't get their dosage correctly, then the fibrosis forms. So I think the MLD plays a really big role in conjunction with the compression garment, because you have a therapist who is trained, who can step in and help you with the drainage. And also while they're there, assess your compression, make sure the dosage is correct.
That's what I wanted to add in, because, you know, you start off with one dosage, and then when the swelling kind of peaks, you might even have to go up a size, and then you have to go back down. And at a certain point, you need to go down more. And it's like, having you has been so helpful, because I'm like, I don't know what's going on, but like, it doesn't feel like it's working as well. You're like, you need to go down a size or put pads in here to smooth this out. And it's like all these things that I would have never figured out by myself, that it's just like, it's so helpful to have someone that knows what they're doing kind of guide you, because, you know, your doctor, you can send him pictures or ask. And, you know, my doctor was like, oh, after 2 weeks, you don't need to wear compression, which I think was a little premature.
It's so funny, because on social media, I'm the compression police. So I will put on my compression police hat, and I'll step in and go, no, 2 weeks. No, I'm going to give you a compression citation. I'm gonna put you in compression imprisonment for a little bit longer.
And you know, it's like, you call it imprisonment, but honestly, it actually, like, in the beginning, actually kind of feels good to be in it. It feels like it's kind of holding you together. I felt like for me, at like the 6 week mark, I could go without wearing it for some time and feel okay and wear it part of the day and things like that, and kind of like start tapering it down a little bit. But those first 6 weeks, you really feel like you need something to kind of help with the swelling and help hold you in. At a certain point, you finally, like, I think you call it thaw out.
Patient is thawing out,
starting to kind of like be able to kind of do it on its own a little bit. And so
you call it decongesting to a normal girl.
I'm a normal girl again.
You know, it's funny you brought that up, because it's this compression is such an ordeal for patients. I've helped recover many thousands of lipedema patients by now, and I can say it's not an easy feat for the patient to endure. It's a lot. It's a lot to go through. And I'll go back to comparing lipedema recovery with cosmetic. I think the compression protocol for recovering from lipedema surgery is way more intense than cosmetic, because it's more involved with lipedema. The whole circumferential of both your limbs, you come back in for a second surgery, maybe do your arms, come back again, maybe do the torso, back to back. The patient is like living in compression for like a year by the time they're done with all their surgeries.
Yeah. And that's a great point. I'd love for you to bring up some of the biggest struggles that people with lipedema having these surgeries, like what's some of the struggles that they have post-surgery versus someone that just has cosmetic surgery? Like what are some of the long-term things that you need to be careful of?
The biggest struggle, especially back when I used to work at the plastic surgery office, is trying to size these patients. We have a lot of advanced stage patients, stage 4, maybe stage 3. And by then the disease have grown so rapidly and all over their body that it's so late stage that they don't fit in a standard garment. So we'll have to find something to fit them in. And it's a difficult process. We'll have to maybe take their measurements before surgery, and then go on a website and look through various different compression garment companies and see if I can find a garment for them that will fit what they're looking for. So the biggest challenge with lipedema recovery is the sizing of the garments. Not having to wear it, in addition to having to wear it forever for like 3 months to a year, is to find something that's relatively comfortable and also proper fitting. For a while, the biggest challenge was to find something that goes past the ankle. In the cosmetic world, compression garments for cosmetic surgery, it's usually stops knee length. It's very rare in the cosmetic world for patients to get liposuction in their calf. Although I've had a handful of patients who've done that, but it's very, very rare. So the length of the compression made for cosmetic patients usually ends at the knee, maybe mid-calf. You will never find a post-op compression garment that goes past the ankle in the cosmetic world. But for lipedema, they need that. Lipedema patients have ankle cuffing. So the surgical procedure is the whole legs all the way down to the ankle. So the biggest challenge was to find something long enough for these patients. And you have patients in various heights, especially the tall ones will have a very hard time finding something that covers their ankle. So the length that I recommend for a post-surgical garment for a lipedema patient is down to the base of the toes to help support the lymph system in fluid return. I, over the years, have found the company Morena Recovery to be pretty helpful in that regard. They actually recently came out with the Lipedema line after years of hassling them.
Compression police is here again.
I'm really thankful. Finally, they came out with the garment that they actually called it the Lipedema line. And it comes down to the base of the toes. So we finally got that taken care of.
No, I think that makes a big difference, like having it kind of wrap around your toes. And I think you bring up a good point, especially when you're in between these surgeries. So like, for example, I've done my upper arms, but I'm not doing my lower arms until later this year. So I needed extra small compression up here, but that was too tight here because I have so much lipedema in my forearms that it was almost like kind of cutting off circulation to my hands unless I pulled it over. So it's like, it's a struggle because you need a certain level of compression in the area that's been operated on, but then you have other parts that you haven't had surgery on yet that are bigger. So it's like finding something to kind of fit this very different shaped body part depending on like the limbs that have been worked on.
And that's the part where I think a certified therapist comes in handy, where you have a professional. I'm mobile, I just do home visits. So you have this certified professional that comes to your home, and I'm looking at their collection of garments and we're piecing things together. I have to find something that's their proper dosage and something that's relatively comfortable that they can wear all day and all night. And that usually is not harmonized.
No.
Something that I find clinically necessary might not be comfortable for the patient. So we might have to compromise a little bit on some of those features, but we're going to work together. We're going to go through various different sources to piece together different garments for different parts of the body for what the patient needs. And it's like what you mentioned, you might need to compress a certain body part, but it hurts. It's not comfortable. I can't sleep. And now it's pinching on another body part. So it's a lot of figuring it out. And that's why I think it's irreplaceable to have a trained clinician to assist you throughout the process.
Absolutely.
And it's so important because it affects your results. There's only so much a physician can do on the surgical table. They are trained at removing the fibrotic fat and they're very good at it. But that's half of the struggle. The post-op, what is happening during the post-op affects the results so much. Wearing proper size compression, dosage, style and fitting all comes in handy. Because if you're not wearing the proper style and fitting and not being properly compressed, the fibrotic, the swelling creates fibrosis. It creates scar tissue. So let's minimize scar tissue formation. Let's optimize lymph drainage and help this patient, once they're done getting rid of the fat, to help heal and recover and decongest back into a normal girl.
That's what we all want, right? So I want to switch gears a little bit. We have time for one more question. So, once you've gone through the surgery, you've spent the year kind of recovering using the compression garments and, doing the manual lymphatic drainage. What's kind of at the 1 year mark post-surgery for a lipedema patient? What does their maintenance plan look like? Because it's like, I don't feel like I'm ever going to stop doing lymphatic drainage. Like it's something, even before I found out I had lipedema, it was so crazy. Like for 8 years, I've been going once a week and I was like, it's the only thing that's helping. It like just helps a little bit. So for me, I feel like it's just such a vital part of my health. And I might switch to like using my pump more than going to like a therapist every week, but having some sort of lymphatic support. But what are some other things that lipedema patients can do kind of as like their post-surgery, post-recovery kind of maintenance plan?
Yeah, that's a good question. I think even though healthy eating does not starve away fibrotic fat and disease fat, it's still important for overall health and well-being. Study shows that if you eat an anti-inflammatory diet, it is good for your overall health, mental, emotional, cardiovascular, everything. It's very healthy to eat a non-inflammatory diet. So I think once you're done with the liposuction procedures and your overall wellness plan should include a well-balanced diet that consists of anti-inflammatory foods. Additionally, getting regular MLD, if you can afford it, maybe once a month or once a quarter, whenever you can, is helpful because not only MLD helps decongest the body. It's good for your immune system. It's
and it feels good.
It feels good. It's great.
It's like a nice little zen moment. Yeah.
Yeah. Most physicians will write you a prescription for the pump. So if you have that available, that's also helpful. Over the years, I've noticed a lot of patients really love to use Ashley Black's Fascia Blaster. That came on the market recently in the last couple years. It's this tool with spiky stuff that's coming out of it, and they rigorously massage themselves with it. And you might think it's too aggressive or it looks intense, but when you have fibrotic fat, when someone rubs you with that fascia blaster, it actually feels really nice. It feels really good.
I got one for after my surgeries. I didn't get that particular one. I might have to look into that one, but I got one that I have, and it looks kind of scary and like spiky, but I tried it. I was like, oh, it actually feels kind of good. I was like, in a weird, strange way.
Patients say they use this term. They go, it's like an itch I can't scratch. So I wouldn't advise you to use it right after surgery, not the first 2 weeks. It's so bruised, tender, and sore. I would wait until there's a time frame where you're not so bruised and tender. And that time frame is different for every patient. Some patients 6 weeks, some patients 2 months out. But that tool, that spiky edge tool, it looks a little funky, looks kind of funny, but it's really helpful in breaking up fibrotic fat.
Yeah, absolutely. Yeah. Awesome. Any other tips for lipedema patients out there as we wrap up?
I think, dry brushing has been popular in the past. It does gently stimulate the superficial lymph system. That's something you can do on your own. I think exercising is great for your overall health and well-being.
Absolutely. Yeah, as much as you can for sure.
And anytime you get liposuction, there is a risk of getting loose skin. And you can balance that with, of course, skin tightening procedures like Renuvion, but you can always help that with doing weight training. I'm a big advocate of weight training, not crazy Olympian style, but like light weight training, like dumbbells and like the Smith machine.
Just because that helps to kind of tone the area and fill in the skin a little bit.
Yeah.
Okay, that makes
definitely.
sense.
That will also help further give you more tone and contour to the body.
Which is so nice to see after all these surgeries. I'm like, wow, I have been going to the gym all these years. I do have muscle in there.
There's muscle underneath.
It's been really nice to see. Yes. Tina, thank you so much. This has been so amazing and informative. If people want to find you or book a session with you, what's the best way to find you?
On my website, harmonylymphatics.com.
Awesome. And we'll link to that in the show notes as well. Thank you so much.
Thank you.